audio preview.
Hi, my name is Alex. I'm 24 years old. I'm a call center agent and I'm positive for AIDS.
Hello, I'm Peter. I'm 20 years old. I work overseas as a seaman and I'm positive for AIDS. I am a very busy worker and I normally don't have any other means of finding relaxation. So every time my boat docks in a certain port in certain cities around the world, I only have one way of finding that relaxation that I needed after working for so long and after working for so hard. And I didn't realize that my partner, my sexual partner, was diagnosed with AIDS. And it was too late when I realized that I went to the doctor and he said that I was positive for it. I didn't know how to deal with it because I even didn't know what AIDS was. I'm still hoping that there is a treatment for this, hopefully. It's only too late now that I regret everything that I've done. Maybe I should have done something different, or maybe I should have found another way of relaxing or finding happiness in my life.
My name is Christopher, 25 years old. I'm a local DJ. I am positive for AIDS.
I cope with this illness by first arming myself with knowledge because there are a lot of myths and bad information about this disease, so it's important that I know so much about this, and also I do my research. Secondly, I seek for support from my family and friends who's unconditionally there for me, and also the doctors and other healthcare practitioners. I could ask for advice as I just keep living my life. I stay focused on my priorities. I'm taking my medicine. I practice healthy lifestyle, and of course, I am avoiding transmitting the disease to others. Basically, I don't want to bring problem to someone else's life. So basically, that's just it.
I'm Mel. I'm 19 years old. I'm a student and I'm positive for AIDS. I am currently undergoing treatment. They call it antiretroviral therapy. Yeah. My doctor said it's an extremely effective treatment as long as I take medicine as prescribed and not skipping the doses. And also each year I get vaccinated to reduce my chances of catching the strains of the flu. And it's an excellent preventive measure to avoid unnecessary infections. So far, yeah, the treatment is going well. It's helping. I get to keep living a normal life as a student.
My name is Checo and this is a special report about AIDS. This is a global issue concerning many young men, especially young men. So today we'll be asking young people about what AIDS is, how they are diagnosed, and how it is treated. We see a young woman here, so let's ask her what AIDS is. Excuse me, ma'am. Can we ask you some questions?
Yeah, sure.
Okay, so do you know what AIDS is?
AIDS. Yes. As far as I know, AIDS is a global condition. It's like worldwide, and yeah.
So do you know how AIDS is diagnosed?
As far as I know, AIDS is diagnosed through a doctor. There are two ways. A person will go to a doctor, and the doctor will test the person for HIV, for an HIV test, and then another is the doctor will check if the person has AIDS-defining symptoms or condition. That's all I know.
Okay, so you have a very good idea there. So do you know how it is treated?
No.
Okay, so if you are given an opportunity to ask a doctor about it, would you take that opportunity?
Yes, sure.
Okay, so that is our live report for today. My name is Checo, and may I ask your name, ma'am?
I'm As.
So she is Astral. So thank you for answering our questions, and that is all.
Hi, I'm Dr. Tan.
So many are asking how to diagnose AIDS, so let's answer that question. So, people are diagnosed with AIDS if they have these certain signs and symptoms of AIDS suggested by CDC. So, symptoms include anxiety, depression, dementia, and insomnia. Blood tests are the most common way in diagnosing HIV, the virus that causes AIDS. There are many primary tests done aside from blood tests that help in diagnosing HIV and AIDS.
Cannot be diagnosed through symptoms, since symptoms may be related to other illnesses. The only way to know if you have HIV is to take an HIV test. To diagnose whether you have been infected with HIV, a blood sample will have to be taken for testing. Tests performed on your blood sample will look for the virus itself, or specific markers, called antibodies, that indicate that the virus is present. These HIV antibodies can be found in various body fluids, such as blood, urine, and saliva. An antibody test is the most common type of test used to diagnose HIV. Antibody tests look for HIV antibodies in blood, urine, or saliva. If antibodies to HIV are detected, it means you have been infected with HIV. Antibody testing is a two-step process. First, an initial screening test is performed, called an enzyme-linked immunosorbent assay or ELISA antibody test. And second, a follow-up test is performed, known as a Western blot test.
Hi, this is Dr. Keith, and today I'll be talking about AIDS treatment. But at this time, there is no cure for AIDS, but medications are effective in fighting HIV and its complications. Treatments are designed to reduce HIV in your body, keep your immune system as healthy as possible, and decrease the complications you may develop. The first medication is the nucleoside reverse transcriptase inhibitors, or the NRTI. So these include abacavir, didanosine, emtricitabine, lamivudine, stavudine, tenofovir, zalcitabine, and zidovudine. So these drugs interrupt the virus from duplicating, which may slow the spread of HIV in your body. Next is the protease inhibitors, or the PI. So these medications include amprenavir, atazanavir, fosamprenavir, indinavir, lopinavir, ritonavir, and sakinavir. So these drugs interrupt virus. Aside from the two, there are other AIDS medication. First is the fusion inhibitors. So they act against HIV by preventing the virus from fusing with the inside of the cell, preventing it from replicating. So the group drugs include enfuvirtide, also known as your Fusion or your T20. So next is the highly active antiretroviral therapy, or the HAART. So it is often referred as the anti-HIV cocktail. So it is a combination of 3 or more drugs, such as protease inhibitors and other antiretroviral medications. So next is the non-nucleoside reverse transcriptase inhibitors, or the NNRTI. So this block the infection of new cells by HIV. So these include delvaridine, efavirenz, and the nevirapine. So these are all the medications for AIDS. Thank you.